This is a C-JSON podcast, and I am Camilo Sotomayor from the University of Groningen. We are here to discuss the results of our newest study aimed to investigate advanced glycation end products as potential non-traditional factors for the excess cardiovascular mortality risk observed in kidney transplant recipients. Advanced glycation end products are thought to increase cardiovascular disease by triggering intracellular mechanisms that amplify oxidative stress and inflammatory responses. Their name makes us easy to remember that these are glycated compounds, which is the result of non-enzymatic reactions enhanced in conditions of chronic inflammation and oxidative stress, just like in the case of kidney transplant recipients. Thereafter, the removal from circulation is largely subsidized by kidney clearance, which is another feature that makes these compounds of particular interest in the long-term post-kidney transplant. Thus, we hypothesize that elevated circulating levels of advanced glycation end products in kidney transplant recipients, as a result of increased formation and decreased clearance, contribute to premature cardiovascular mortality. To evaluate our hypothesis, kidney transplant recipients with a functioning graft for at least 1 year were recruited in the context of regular outpatient visits. In 555 patients, we performed extensive laboratory phenotyping at baseline, including measurement of 2 specific advanced glycation end products. During a median follow-up of about 7 years, 122 patients died, more than half due to cardiovascular causes. We observed that per 1 standard deviation increment in circulating advanced glycation end products, patients were at 1.5 times higher risk of cardiovascular death, independent of traditional cardiovascular risk factors. We also observed that about 1/3 of this association was mediated by oxidative stress and endothelial dysfunction biomarkers, in agreement with the general theory of advanced glycation end products pathology. Thus, we conclude that advanced glycation end products significantly contribute to premature cardiovascular mortality of kidney transplant recipients. These results warrant further studies to evaluate whether monitoring advanced glycation end products may open novel avenues of long-term clinical follow-up post-kidney transplantation. Whether advanced glycation end products may be helpful to assess prognosis and tailor existing treatment remains to be further investigated. We hope you enjoyed this podcast.
This podcast is copyrighted by the American Society of Nephrology, all rights reserved. All content in this podcast is for informational purposes only and is not intended to be medical advice. This podcast should not be used in a medical emergency or for the diagnosis or treatment of any medical condition. Please consult your doctor or other qualified healthcare provider if you have any questions about any medical condition or before taking any drug, changing your diet, or commencing or discontinuing any course of treatment. Thank you for listening to this podcast of the American Society of Nephrology.